Oh, sorry. So we have a pre-test that we normally do. That's the culture. Apologies for that. And Mrs. Olorunrinu, can you share your screen with us, please, for the pre-test? Thank you very
Yes, ma'am.
much.
Yes, ma'am. I'm sure people can see the pre-test. If you can't, please indicate in the chat box. Okay. That means everyone can see it.
Okay. So we have like should I say 5 minutes or 10 minutes to take the pre-test?
I think 5 minutes works.
Okay, 5 minutes. So we have five questions altogether, and then we need to answer them.
Okay. So just throwing it out there also. We're live on We're Calso on YouTube. So you could tell our family and friends to join us on YouTube as well. And if you want a run through of this program again, if you'd like to view it one more time, it's on YouTube. So we have all our past medical podcasts right there on YouTube. During our free time, we can always just go back, you know, to watch the program again and to learn. Thank you very much.
So we have 2 more minutes. Okay, I think are we all done with the pre-test? We can raise our hands if we're not done so that we can buy more time.
Looks like just 50% have been able to um
Okay, should we give more time, Mrs. Olorino?
um let's see. No, I think we could just jump right in.
Okay, all right, then that's fine. Um, so like I said, our speaker today is Dr. Bolanle Okunowo, and she'll be speaking to us on obesity and its complications. So, Dr. Bolanle, you have the floor, please. Thank you very much for coming.
Okay, thank you so much, distinguished members of Council, for inviting me to this podcast. I really count it as a great privilege for being here amongst you, and I will try to make the forum as interactive as possible so that all questions and all concerns can be well addressed. So I'll be sharing my slide now.
Thank you.
I don't know whether it's visible, the slide.
Yes, I can see
Okay.
from my end. Yes,
Oh,
it's visible.
okay.
Yes.
Okay. Thank you so much, ma. Thank you so much, ma. So, good evening once again. I'll be talking about obesity and its complication. And these are my outline. I'll be looking at what's the burden of obesity in the world and even in Nigeria. We'll be looking at what's the definition of obesity, the causes, what are the complications, and how can we go about managing obesity, and most importantly, how can we prevent it? So now, in 2022, it was estimated that the prevalence of obesity in the world was 890 million. So it was estimated that 890 million people were living with obesity. And it was also estimated that children under the age of 5 years, about 37 million were living with obesity. And they now projected the prevalence of obesity from 1999 down to 2022. And they realized that there was a doubling of effects in terms of the prevalence and the number of people living with obesity compared from 1999 to 2022, like a double effect in adults, talking about 100% increase. And there was a quadruple effect in adolescents. Adolescents are children between 10 to 19 years. And in 2022, it was discovered that 1 in 8 adults are actually obese. So now, the World Obesity Day was celebrated this month, precisely 4th of March 2025. And the theme for this year's World Obesity Day was changing the system and living a healthy life. And this theme was based on the huge prevalence and huge burden of obesity globally and even in Nigeria. So now it's been projected now to 2035 that about 1.9 billion people will be living with obesity come 2035. So there's a huge burden in our hands as clinicians and even non-clinicians, everyone, the burden, 1.9 billion. And when they estimated the economic implication of this, it was discovered that by 2035, they'll be spending about $4.32 trillion on management of obesity and its complications. And it's also projected that come 2035, there'll be an 100% increase in childhood obesity. Children are people less than 18 years old. So there'll be 100% increase in obesity. And by then, 1 in 4 people will be living with obesity. Then in 2022, it was 1 in 8. So it's been projected that in 2035, 1 in 4 will be living with obesity. And there'll be doubling of adults living with obesity come 35. So obesity is actually a huge problem, and Nigeria is not left out. In Nigeria, the prevalence of obesity is shown in this graph, and you can see that the prevalence of obesity is higher in women and in the girls population. So in the girl population, the prevalence is 10.30%. So we can explain it like 1 in 10 girls is actually obese in Nigeria. And in women, adult women is 9.9%. So it's almost the same with a girl child. So 1 in an adult woman, a woman is living with obesity. So we're talking about the women, 1 in 10, they are living with obesity. So obesity is also there in the boys and in the men, but it's not as prevalent and severe in adult women and the girl child in Nigeria. So looking at the Commonwealth countries, Nigeria, the prevalence of obesity and overweight in Nigeria has been summed up to 38.6%, compared to the Commonwealth countries. And so this is a real issue in our hands, and we really need to start addressing it. And more so, obesity can actually be well prevented. So the World Obesity Day are celebrated for those. This is just a picture of a woman, that is obese. She's doing everything possible seated. So there's reduced activity level, because is either the reduced activity level predisposed her to obesity, and the obesity itself further limits being able to, be more active. And, so this is also a male. And the reason is that the word obesity is so important because it's an avenue to create an awareness and also advocate for real practical solutions in addressing obesity crisis in the world and even in Nigeria. And the prevalence of obesity is high, but when you look at the prevalence of overweight is even higher, because it was estimated in 2022 that adults living with overweight were 2.5 billion adults, and obesity was 890 million. So, and overweight, when not well addressed, leads to obesity eventually. So now, obesity itself is a complex disease, and it goes beyond individual effort. That's why I really appreciate the theme for this year's World Obesity Day that talk about changing the system. So it's beyond an individual effort. It's a whole community, a whole nation effect in terms of, combating the prevalence and the burden of obesity in Nigeria and also globally. So now, let's look at what the classes of obesity is. Sorry, I think I jumped, yes. Okay, so now what is obesity and what is overweight? Overweight and obesity can be defined as abnormal or excessive fat accumulation that represents a risk to the health of such individual. So that is obesity. When there is accumulation of excessive fat that now serve as a risk to the health of such an individual. So now, what can we define as overweight? Overweight is when the BMI of an individual is 25 and above. So that person is considered overweight. And how do you calculate BMI? BMI is weight divided by height squared. So when you do your weight, you divide it by height in meters squared, then you get your BMI. So when the BMI is 25 and above, the person is considered overweight. But when the BMI is now 30 and above, the patient or the person, the individual, is considered as being obese. So now, obesity, like I said, is in adults, is in children, and in children, the definition of obesity or overweight is totally different from the definition in an adult. So now, in children, the definition of obesity is when there is excessive body weight above the 95th percentile for the age and the sex of that child. So when there is excessive body weight above the 95th percentile for the age and the sex of that child. So now, obesity and overweight is a chronic disease. That's why we are talking about complications. It's a chronic disease, and it's not just about, oh, this person doesn't have a good self-control, or this individual doesn't have a poor willpower. It's actually a chronic disease, and there are many factors, implicated in obesity. Now, so obesity and overweight is actually an interaction between the individual genetic predisposition to weight gain, because we all have different genetic predisposition to weight gain, and also the environmental influences. So the environmental influences plays a role, and also the individual genetic predisposition to weight gain plays a vital role in whether an individual will be overweight or obese. Okay. So now, what are the different classes of obesity? I've explained what an overweight individual is. So now obesity can be classified into class 1, class 2, and class 3. Class 3 is actually severe obesity and is also called morbid obesity, and is associated with a lot of cardiovascular and health issues. So now, what is class 1 obesity? We said that obesity is from 30 and above BMI. So now, class 1 is when the BMI is between 30 to 34.9 kg per meter squared. That is class 1 obesity. Class 2 obesity is when the BMI is between 35 to 39.9 kg per meter squared. And when the BMI is now greater or equals to 40, the individual is said to have severe obesity, morbid obesity, and this is actually associated with a lot of cardiovascular and health implications. So it's so important we are conscious of our BMI. So we can calculate it at home, on home basis. You can be checking your BMI monthly and be noting it and be working towards dropping some weight or as required based on what your BMI reads. So now, there are different types of obesity, and we have what we call the apple or android form and the pear organicoid form. So now, what is the android form? It's also called apple form. So when you look at this man, you can see that there is obesity more on the trunk, on the abdomen of this child. So when there's excess fat in the abdomen, that is android obesity. And it's usually common in men, but it can be seen in women also. It's seen quite a number. There are quite a number of women that comes to my clinic and they have android obesity. And this is associated with a lot of metabolic syndrome. Metabolic syndrome is a group of conditions which involves diabetes, obesity, cholesterol problem, lipid problem, dyslipidemia, overweight, and a lot of other issues that is all in and the problem about this metabolic syndrome is not just the constellation of or group of those conditions, is because this metabolic syndrome is associated with a lot of cardiovascular complications like heart attack, stroke, and coronary problems, heart failure. So because of the effect of metabolic syndrome, you really don't want an android obesity. So now the second type of obesity is called the gynecoid obesity. It's also called the pear obesity. Look at this woman. The obesity is more at the hip region, not so much in the abdominal region. So the obesity is more on the thigh and the buttocks. This is commoner in women, and it's the effect on it causing metabolic syndrome is not as severe as android obesity. So metabolic syndrome, most times they can be metabolically neutral, meaning that they don't have a metabolic syndrome, except that the fact that they are obese. So this is milder compared to the android obesity, because the android obesity is associated with metabolic syndrome. So now, when we are talking about the abdominal obesity that is seen in the android obesity or the apple type obesity. So the android obesity, the abdominal obesity can be categorized into two. We have the subcutaneous fat and the visceral fat. So what do I mean by the subcutaneous fat? Subcutaneous fat means that the excess fat is after where the abdominal muscle is. That is the subcutaneous fat. So it's above the abdominal muscles of the individual. But the visceral fat is before the abdominal muscle. That means the visceral fat is closer, is covering the internal organs of that individual. So you see some individual that are obese, they will tell them that they have fatty liver, they have fat around their heart, they have fat around their pancreas. Those are the visceral obesity. So the visceral obesity are adipose tissue, which is all about abdominal obesity. So it could be subcutaneous or visceral. Visceral is when those fat tissues covers the internal organs of that individual and is after the abdominal muscle. And so this visceral fat, they are more metabolically active. What does that mean? That means that they can predispose the patient to a lot of complications like insulin resistance, diabetes, they can have cholesterol problem, they can have attack, they can have all the cardiovascular complications associated with the visceral fat. So the visceral fat is more injurious to health compared to the subcutaneous adipose tissue, though both are unwanted. So now, talking about the visceral fat, so you can assume whether you have more visceral fat than subcutaneous fat by doing what we call your waist circumference. So there is a waist circumference that can serve like a marker to show you that it's likely that this individual has high visceral fat compared to a more abdominal fat. So now, for women, when the waist circumference is greater than 88 centimeters, the person is at increased risk of higher visceral fat. And we've said that visceral fat is very injurious to health because it's associated with a lot of problems, insulin resistance, diabetes, hypertension, heart attack, and stroke. And for men, when their waist circumference is greater than 102 centimeters. So this can be measured at home yourself, or even when you see your or your doctor, or you go to the clinic. So the waist circumference, you should be aware, everybody should be aware of what their waist circumference is. So now, talking about the causes of obesity. The causes of obesity are numerous. So that's why it's not just about the willpower. It's not just about inability for the individual to control the individual's intake, but it's still part of it, but it's not just, it's a complex chronic disease. So now, obesity is associated with eating habits. You know, there are a lot of people that, you know, eat late into the night. Eating late into the night is a dangerous thing. It's very injurious to health. Ideally, your dinner should be taken latest 5 or 6 p.m. So when someone is eating dinner by 10 p.m., 11, 12 midnight, 1 a.m., 10 p.m., is very injurious to health. And such things makes the person accumulate visceral fats and become obese, because at that period in the night, your metabolic has slowed down. Your activity level has slowed down. So anything you eat at that time, you are likely to store them. You are likely to store that. So the food eating habits, there are some people that, you know, they eat in between meals. So ideally, your largest meal should be in the morning. Your largest meal should be in the morning, then followed by afternoon. Your smallest meal should be in the evening. Your meal in the evening should be the lightest so far. compared to afternoon and morning meals. So eating late in the night, eating heavy in the night. In the night, 10 p.m., eating fufu, eating pounded yam, eating beans and bread. All those things will predispose to visceral fat. And there's no how such individual will be obese. There are some people that they are in the Abbey, because I see quite a number of my patients. They will tell me in the night, if I don't take Ovaltine, if I don't take thick Milo, I will not sleep. So in the night, when they are taking their fufu and prepare their fufu and eating vegetable, they console themselves that they are eating vegetable with the fufu by 10 p.m. And they'll make thick Bonvita, thick Milo, and drink it with the fufu and say, yes, I'm ready to sleep. That is visceral fat, and that is obesity, which is very injurious to health. So now, looking at other factors, including, and also in terms of let me quickly mention here that in terms of sex, studies have shown that men has a higher metabolic rate than females. So I'm not surprised that women had more obesity compared to men, because men has a higher metabolic rate even when they are resting. So compared to a woman. So a woman, and again, as a woman advances in age, especially when they become postmenopausal, their metabolic rate is reduced drastically. So you can't afford to be indulging in many things that are not profitable to the health at that age. So you have to be very, cautious, to eat healthy. Another cause of obesity is reduced physical activity. And this is so common in our age and our time, because like in this meeting now, I'm seated and I'm giving this presentation. Suppose it's a physical meeting, I'll be moving around the hall, and it's a form of exercise. So majority of individuals are even working from home. They are working from home. The majority of they come to their company twice in a day. So they are seated doing everything. They take their breakfast seated, lunch seated, and even when they are back from work, they are relaxing. So there's a lot of reduced physical activity, and even our environment. That's why I like the theme of this year's World Obesity Day, which says, changing the system. We need to change the system. The government is involved in this, because the schools, majority of the schools, they don't have a playing ground again. And most times, a lot of children, they go to school and their mother pack chocolates, they pack food. They hardly do they put fruits or vegetable in the food pack of their children. Meanwhile, there's no playing ground for the child. The child sits in class, no playing ground, comes back home, consume a very dense, you put juice in their food pack, you put chocolate, sweet, lollipop, rice, you put all those things inside the child food pack for just for their lunch in school. By the time they come back, they consume again, and it's a whole lot, because most schools now, in those days, the playing ground is so big that you play, all your clothes, but now the playing ground is markedly reduced. So reduced physical activity. So it is obtainable both in children and in adults. So now genetic causes, there are genetic causes that predispose a child to developing obesity. So there are some children that they have genetic causes. So some people with Down syndrome, Prader-Willi syndromes, and all other things, So same, there are some people that are on some drugs, and those drugs, they are mandatory because of the health condition they are managing. So people with autoimmune disorders, SLE, rheumatoid arthritis, they usually give them steroid. Steroid is known for obesity. It's called, in the colloquial language, mawu. Some people, in the local setting, they go, especially the slim people, they'll say, please, so mix mawu for me, I want to be fat. And all these steroid causes more of visceral obesity and causes a lot of problems, and even endocrine problem, Cushing's syndrome, Addison's disease. And so there are some patients are on drugs. So when you're on drugs like steroid for for a medical condition, you are under the surveillance of a doctor that is monitoring your progress on that drug. You are not just taking it arbitrarily. Also, people with asthma, sometimes when they have a serious asthmatic attack, they give them steroid for some short time. I remember seeing a patient that came to see me. The patient has already developed Addison disease. The patient had asthmatic attack, and the doctor gave the patient a steroid for just 5 days. But because the drug worked so well, the patient felt, wow, I've gotten the magic. I'm not seeing the doctor again. I know what to do. I know how to manage this asthma. And the patient kept on taking the steroid for almost 4 years. The patient developed a lot of complications, the osteoporosis. The patient developed, suddenly the patient now missed the steroid for some few days, and the patient now came down with adrenal insufficiency and landed to my endocrine clinic. So there are a lot of things. So out of prescription drugs, there are some people that, you know, when they've seen doctors give them a drug for 5 days, but because it worked, they now keep that prescription, keep replacing and buying. And, you know, that's why this word obesity test talks about changing the system. There are some drugs that patients should not be licensed to buy without a doctor's prescription, you know, to which it must be stopped. You know, that even at the level of pharmacy, they will tell you, where is the doctor's prescription? And if the doctor's prescription says 5 days and is expired, the date is expired, they shouldn't refill that drug for the patient. But because most of this patient gets to get this drug free, easily from the pharmacy, they keep on replacing, and they end up with a lot of problems, obesity, and even other endocrine problems. So there are some psychological causes of obesity. People that are depressed, they hardly do anything. They keep eating, and they do a lot of binge eating, intake of alcohol. So depression is a cause of obesity. So, and also obesity can cause depression. So psychological causes is there. We have a lot of endocrine causes of obesity, and among the endocrine causes is hypothyroidism. So when the thyroid hormone levels are low, people with polycystic ovarian syndrome, they can be obese. So that's why a patient with polycystic ovarian syndrome is prone to developing type 2 DM and other cardiovascular complications because of insulin resistance. So they need to see their doctors for proper management. Cushing syndrome, acromegaly, and these are other genetic problems that can cause obesity. So now, in simple terms, what is obesity? Is when your energy input is more than your energy output. When your energy input is less than your energy output. Normally, for you to attain a stable weight, the energy input from your calorie or things you are taking should be equivalent to your output. But when there is a reverse in the balancing, then obesity will come in. And there are many factors that could cause that. Hedonic hunger. There are some people that they just eat for pleasure. When they feel that, oh, I don't feel like doing it, they'll just say, let me just go to one spot. Let me just take pepper soup, catfish, and just feed on it. So they eat for pleasure. They see eating like a pleasure. Eating shouldn't be a pleasure. Eating should be when it is necessary. So you can't just eat just because you feel like relaxing, and your form of relaxation is binge eating, you know, just going to a spot, eating, you know, and, you know. So all these things can also, another problem is when there is disorder, impaired metabolism. I've explained other conditions that can cause that, genetic predisposition, when there is an hormone responsible that makes you feel satiety, that makes you feel I'm okay, I'm fine. When there is an imbalance between that hormone that causes hunger and the hormone that tells you that I'm fine. So that can predispose to this energy input and output imbalance. So now, still talking about the hormones. So we have what we call leptin. Leptin is an hormone that is produced from the fat cells. So this leptin signals to your brain and tells your brain, oh, suppress the appetite. So normally in people that are obese, they have leptin produced from their fat cells. So this leptin should signal to the brain and suppress the appetite so that they don't keep eating. But it's been found that in people that are obese, they have what we call leptin resistance. So though the fat cells are producing the leptin is not working in suppressing the appetite, and they keep on eating and eating and eating. So we have another hormone that we have in our body, and it's called the ghrelin. Ghrelin is produced from an empty stomach. So when you are really hungry and your stomach is empty, there's a hormone that is produced called this ghrelin. So this ghrelin signals to your brain and says, oh, the stomach is empty. Tell this individual to eat. So the brain tells you, oh, find something to eat, and you will actually eat. And the production of this ghrelin is now suppressed. So that's how the body balances between feeding and non-feeding states. So the ghrelin and the leptin. So when there is an imbalance in this, there can actually be, obesity. So now we've talked about the various causes of obesity. So let's look at what is the implication, what's the complication of obesity. They are so numerous. So with obesity, the patient, the individual is prone to both respiratory problem, hormonal problem, immune problem. The immunity of that patient, the person that is obese, is depressed. There's a depressed immunity. You can see there's a reduced T cell dysfunction and response. Obesity itself can cause problems with breathing. The patient has hypoventilation. The person cannot breathe very well. The person can have sleep apnea, to which when the person is sleeping, the person can wake up suddenly with difficulty breathing while sleeping because of sleep apnea. There's reduced air oxygen level, that's the FRC, functional reserve capacity. That means the air within your lungs. Normally when we're breathing in and out, we have a small air that is in our lungs all the time. For people that are obese, there's reduced in that capacity. There's reduction in that capacity. Also, the reduction in the chest to move up and down during breathing with easy movement is reduced in people that are obese. So they have a lot of respiratory problem. They also have a lot of endocrine problem. They have problems with diabetes. They have problems with hormone thyroid. They have low testosterone, so they can have infertility. They can have Cushing syndrome, high cortisol. They can also have reduced cortisol, depending on what stage of obesity they have. They are also prone to a lot of cardiovascular problem like heart attack, stroke, because of the problem with they can form clot easily. They can have other problems in their hearts. So they are prone to a lot of stroke, the other comorbidities. They are prone to hypertension. They are prone to cardiovascular problems. They are also prone to the effect of the weight. They have osteoarthritis. They have problems walking, osteoarthritis. If they are diabetic, because of the osteoarthritis, they can fall and they can develop what we call diabetic ulcer, which can be poor to heal, because normally obese people, when they go through surgery, the wound is always a problematic to close up because of the fat covering that. And so the healing is reduced, is poor with obese people. So all these are part of the complication and obesity patients have. So now I want to categorize this complication based on what their obesity is. So we have for people that are obese, what the very obese people, what they really have, what is greatly increased, what is the complication that is moderately increased, and the complication that is mildly increased. So now talking about the greatly increased complication in people that are obese, type 2 DM. So some of them, quite a number, they come to my clinic, they have type 2 DM. Some are not even diabetic, they are already pre-diabetes. Pre-diabetes means the sugar is not yet diabetic level or normal, is in between normal and diabetic. And at any point, they can move to full-blown type 2 diabetes. So they have gallstone, they have fatty liver, and fatty liver is a condition whereby the fat cells have infiltrated the liver, and it causes liver problem, and it can cause a liver failure. They have gallstones, they have cholesterol stone in their gallbladder, stones in their gallbladder because of the cholesterol. They have problems, they have dyslipidemia, which is cholesterol problem. They have the metabolic syndrome that I talked about earlier. They can present with breathlessness. They walk a short distance, they are very breathless. They'll be resting in between, breathing heavily. They have sleep apnea. When they are sleeping, they wake up suddenly with sudden difficulty with breathing, sweaty, and and so they might need a pulmonologist for a review. So now, talking about the moderate increased complication they can have coronary artery disease like heart attack, they can have a stroke, they can have heart failure, their heart can be on the big side, the hypertension, osteoarthritis of their knees, of their hip, they can have arthritis, they can have uric acid level, they can have gout from the high uric acid they have, and it can manifest as swollen big toe, swollen and painful big toe, and they can have that. And the mildly increased complication they can have is it's obesity predisposed to cancer. Cancer, just think of any of the cancer, breast cancer, and cancer of the endometrium, colonic cancer, liver cancer, prostate cancer, gallbladder cancer. Just think of any cancer. Obesity is a risk factor for those cancer. Also, polycystic ovarian, infertility. You see a lot of women coming to my clinic complaining of infertility, and by the time I do their BMI, they're very obese, and we have to address this. They can also come with polycystic ovarian syndrome because of the obesity and the polycystic ovarian syndrome. They have poor ovulation. They don't ovulate, and that's associated. So they can have multiple pains, back pain, knee pain, shoulder pain because of obesity. And also when they are to go through a surgery and you have to put them to sleep, they have a lot of increased anesthetic risks, because to put them to sleep is usually difficult because they have a short neck. So to pass a tube and put them to sleep is always difficult because of their short, thick neck. And also women that are obese and are pregnant, they usually deliver a lot of babies that have problems like congenital heart defects. Those babies can have neural tube defects. Those congenital heart defects are what they call hole in the heart in the baby, all because the woman is obese. And also those women that are obese, that are pregnant, they can have diabetes in pregnancy. And so these are a whole lot of complications of obesity. So I've tried to sum them up with this slide, showing all manner of complications associated with obesity, depression, infertility, osteoarthritis, stroke, gallbladder disease, varicose vein. Those obesity predisposed to development of varicose vein. You'll see when you look at their leg, you see thick varicose vein is because of the effect of obesity. They have cholesterol problem. They can have fatty liver, which can predispose to liver failure and diabetes, gout, hypertension, and heart disease. It's so numerous. So this slide is just trying to summarize all the complications of obesity. So now, what is the treatment of obesity? So anybody that is obese, you need to be patient with yourself so that all can be resolved. You need to present to the hospital so that we can do a proper evaluation to know what are the causes, what predisposed you to this obesity. Are there endocrine causes? Are there psychological causes? Are there any causes that is causing this obesity, and so that it can be properly managed? So the first thing is there's no regrets. You need to be patient with yourself. So now the management of obesity depends on what stage of obesity the patient is. So this slide is just trying to explain what can be done. So for management of obesity, it's so important. Lifestyle changes is so important. Eating healthy and exercise cannot be overemphasized. So lifestyle changes is very, very important in the management of obesity. So when you do a lot of lifestyle changes for this patient, you counsel them. You also is a multidisciplinary treatment in terms of the dietitian is involved, and depending on what is the underlying cause of the obesity, whether in children or in adults. So that will determine so the endocrinologist is involved, the dietitian is involved, the physiotherapist is involved. So there's a lot of lifestyle changes in terms of that will be put in place for this individual. And if there is any problems the obesity has caused based on the complications I've mentioned, you want to address those problems while working on the weight of the individual. So based on the lifestyle changes, once you've introduced the lifestyle changes and this individual in 6-month period has not lost any appreciable weight, you might consider introducing some drugs that can help the weight loss. So, but those drugs, the drugs that will be introduced depend on each patient's profile. So you don't just give everybody the same drug. It has to be under the surveillance of a doctor. So there's some obesity that when is about 35 kg per meter squared and above, and the patient has a lot of complications, and so most times when they do lifestyle, and the patient might need medication or even some surgery to address the obesity. So there are different surgeries that can be done for people that are severely obese, and it will really help them drop, about 10% of their weight. And they call them metabolic surgery. So they are licensed depending on, so it's your doctor has to properly evaluate you to determine what you really need. So there are different drugs that have been approved for weight loss over the years. Olistat, phentermine, topiramide, liraglutide. What we have currently running all over, people talking about it, is the semaglutide and tirzepatide. The semaglutide is Ozempic. But unfortunately, we have a lot of parallel market importation of this drug into Nigeria with a lot of side effects. A lot of patients are coming to me. Nobody recommends the drug. They had it from their cousin, their family member, their friend at the workplace, and they just get the drug through parallel importation, start injecting themselves anyhow, come down with complication of the drug, land in my clinic. So there are a lot of issues on this drug, even zip-bound, tirzepatide, they are good drugs. It's not as if they are injurious if they are taken under a doctor's surveillance. They are very good. They have a lot of cardiovascular protection, kidney protection when they are used appropriately. But unfortunately, they are just used so inappropriately. People just buy it. They buy for their friend, call their friend in the US, in UK, in Germany, send me this, package it, use it, no dose regulation, and they end up with serious complications. And it's a real problem in the society. And some, because the drug, they are not buying the licensed drug, they are buying a lot of imitators of those drugs. So the drug is not the licensed one. They now buy the fake version of the drug, and that fake version gives them a lot of complications. And unfortunately, when you look at that fake version of this semaglutide, Ozempic and tirzepatide, Zimbalm, they look so much alike. It's just a small difference that differentiates the original from fake. They look so much alike in color, in the way it's written. It's just a tiny mark in one corner of it that differentiates the original. So people buy it, use it anyhow, not under any prescription, as advised by their friend, their well-wishers, and they develop a lot of complications. So this is a huge problem currently happening in our society, and that needs to be seriously addressed. So now, like I said, obesity is a multidisciplinary management. It's not just about, the dietitian is involved. It's not just about just reduce your food. No, there's a lot of things. So dietitian is involved, behavioral and motivational therapists, You need to encourage the patient to change, the lifestyle, how the patient is the individual is living. If the patient has been living a sedentary lifestyle, the patient needs to be encouraged. If the patient is depressed, that's why the patient is obese. You need to address what is causing that depression, treat the depression so that the patient can come out of the obesity. So there's a lot of behavioral and motivational therapies. There are some people that eat for pleasure. They need motivational behavioral therapists to know that eating is not for pleasure. Eating is when necessary. So they need a physical therapist because they can develop many complication arthritis. So they might need a physiotherapist, physical therapist. They might need an endocrinologist because it could be due to hormonal complications. They might even need a bariatric surgery. There are quite a number of my patients that have advised for bariatric surgery, and they are doing quite very well. So it involves the endocrinologist, and sometimes they will tell them that in case you have friends that are obese, you people can form a WhatsApp group to be encouraging yourself, to be telling yourself, now let's go to the gym, let's go together, let's go and register, let's do some jogging together, or your family members, you keep encouraging yourself, or in the evening you can send a message to the WhatsApp. Hope everybody has taken their dinner by 5. Let's not forget our dinner must not pass 6 p.m. so that everybody can now, wake up, quickly take up their dinner and move on with that. So for weight loss, for your weight loss to be significant, it has to be 5 to 10%. And this has to be slowly. It's not drastic. Drastic weight loss has a lot of complications that the patient can end up with. So we don't advise a drastic weight loss. So the weight loss has to be regular and steady within 6 months. So if a patient reduces weight between 5 to 10%, it's a significant weight loss, and it's been associated with reduced complication and reduced, even those diseases associated with obesity, is reduced. So now with 10% weight loss, there is reduced death, mortality. That means there is 20%, more than 20% reduced mortality from weight loss. There's 30% reduction in diabetes related deaths. There's 40% reduction in fall because obese people fall easily. So there's 40% reduction in fall when there's loss of 10% of weight. Even the blood pressure is not left behind. With a 10% drop in weight, there's a fall in the blood pressure, the systolic blood pressure and the diastolic blood pressure. The systolic blood pressure is the blood pressure on top. That top part, that's the systolic. The down part is the diastolic. So there is 10 millimeter of mercury reduction in blood pressure. Also,
Hello,
there's
Dr. Kunawa.
50% reduction in glucose level when there's 10%.
Hello, ma.
Yes, ma.
Sorry to interrupt you. I will say, can you run through the remaining slides probably in the next 5 minutes so we can take people have loads of questions to ask, so they are waiting. So
Okay,
5 more minutes,
okay,
ma. Thank you.
okay, so sorry.
Thank you. Sorry,
Okay,
apologies to
please, thank you.
interrupting.
Okay,
Sorry.
no problem, no problem. So now, reduction in cholesterol level is so much. So weight loss is advocated and it has to be supervised. And, and with weight loss, there's reduced mortality and morbidity. So the treatment goal is that you want the patient to lose weight and not to gain further weight, and also to maintain that continuous weight loss. So now I've talked about this. So prevention of obesity. When we are talking about prevention of obesity, it involves the government, it involves the individual, it involves the community. So for the government, we need to promote and support breastfeeding and healthy eating. We need to involve the media for campaign to make awareness, on obesity, even in schools, to ensure schools have enough playing ground. We need to strengthen food policy in Nigeria. There should be sugar and sweetened beverage tax. So for each excess sugar in a food, for all those beverages that we use, all those fizzy drinks, they must be taxed for their sugar. And the same way when the advert of tobacco is saying that anybody that smokes is liable to die young, for when they're advertising all these beverages and fizzy drinks and everything, they should make that advert and say, when you take too much of this, you are likely to die young, so that people can be conscious of it I know there are some people that takes 4 bottles of drinks, soft drinks and juices in a day. All these things, even alcohol should be, all these things should be taxed. And depending on the percentage of alcohol, there should be a tax on these food things. And even their adverts, when they are making the advert, they should say, excess of this alcohol, you are likely to develop, I die young with cardiovascular complications, so that it will give people some awareness about this. So there should be good road network so that people that cannot afford gym, they can do a workout on the road, especially in their estates. It should be safe so that even when they are doing their workout, there is no issue of, hazard to any individual. So it's important. So, and we always tell people that when you are working on your weight, don't skip your meals. Don't skip your meals. Skipping meals is more dangerous. And in fact, skipping breakfast has been associated with obesity. So don't skip your meat. Your breakfast should be your dinner should be the lightest. Take a lot of fruits and vegetables. Reduce oily food. Eat slowly. Don't eat fast. People that eat fast has a high tendency for obesity. Take a low caloric diet, especially when you're at your work. If your work is on the second floor, don't decide to take the elevator. Take the stairs and get to second floor, a form of exercise, because your work, you sit more, walk to your grocery store. And if there's a depression, let's handle it. A lot of behavioral change. Don't eat while in front of your TV. Don't snack, why. So, and if there's need for therapy, please just present yourself to the hospital for proper evaluation. So the impact of television is not just on the behavior it produces, but the behavior it prevents. You can see the person now becomes like just seated or watching television like a yam on the seat. So it's so important. And when you are buying anything from the grocery stores, look at the nutritional value of what you are buying. Look at the calorie of what you are buying. And it's so good that if all our food can have label, like Gary, let it have label. Rice, let it have ofada, basmati, let it have all labels, which guides the person to be able to monitor your caloric intake. WHO says that obesity cannot be prevented or managed solely by government or health professional. The food industry, the international agency, the medical community, the individual need to work together so that the environment is less conducive for weight gain. So I put this slide here. This one says that the heaviest thing I carry is the comment from healthcare professionals, the ones that are here on public transport or in stores. Obesity is a disease. Yet, what keeps me away from others and stop me from being treated is fat phobia. More than my own weight, what bothers me the most is the weight of your words. So don't body shame anybody that is obese. It can be worked on and it can be totally reduced. So the weight of the world is changing. So like I said, in 2035, 1 in 4 people will be obese. So everybody needs to act to create a healthy future for everybody. So let's end the stigma for obesity, or rather let's help stop the burden of obesity in our society. So these are my references. Thank you very much.
Thank you very much, Dr. Bolanle. We really appreciate that. Um, so I know our council sisters here are going to be very, very happy about this. And I know that some of them have started training their questions. So, to my council sisters, if you have any question, can you just throw it in the chat room and I'll read it out to Dr. Balanle so she can answer you. So, because of our time, we won't have to do much. I have right now, I think 2 or 3 questions here. So one of some of our council members just asked is, one of our council members just asked, what do you think about Ozempic or Monjaro for severe obesity? So there's the brand Ozempic, there's Monjaro, and I think there's other brands. However, those are the two popular brands. So what do you think about that for severe obesity? I know you have said a bit of it in this presentation. However, for the purpose of those that have asked, maybe you can just give us a quick answer to that.
Okay. Oh, so now in terms of Ozempic and Monjaro is also there's another brand called Zipbound. So Ozempic and Monjaro, they are good drugs and it's like a breakthrough in solving the problem of obesity. But the issue is they should be used under a doctor's prescription and guidance. So they are very healthy. They have a lot of cardiovascular protection. The Ozempic can cause about 15 kg loss of weight.
Wow.
The Monjaro or Ziband even cause a higher weight loss, about 20 kg to 25. And it's used over a period and under surveillance. Weight, some people just start that drug on the highest dose. And the dose should not be started like that. It should be started with a titration. So there's a lot of issues, but they are quite good drugs, but it should be given by a doctor. Thank you so much for that
Okay,
question.
thank you, ma, for answering that. Also, I know you have said this. However, I want to ask. Someone has also asked that what are the major complications of these two drugs? So the main ingredient is you said segmalutide or something. What are the main complications of
Semaglutide.
using this
Okay.
semaglutide? What are the main complications of using this without a doctor's prescription? And even if you're going to prescribe it to your patient, what are the things you're going to be telling them to look out for in terms
Yeah,
of
so
side effects?
okay, thank you so much, Ma, for that question. So
Yes.
the problem with Ozempic is that most times because they prescribed, people take it out of doctor's prescription, they use it anyhow. So they present with a lot of side effects and end up hospitalization. They can have problem with gastric pain. That means the upper part of the abdomen is painful. They can end up with hospital admission. They are bloated. They can have diarrhea. They can vomit. So it's associated with bloatiness, diarrhea. Normally, the drug works by suppressing your appetite, and also they helps control the blood sugar. They helps also people. They help the heart. They help prevent complications relating to the heart. They help prevent kidney-related complication. But when it is used anyhow, without any format, without under any supervision by a proper physician, it creates a lot of complication. And most times, a lot of patients, develop complication now needing an hospital attention. Yes, so that's for Ozempic, semaglutide. For
Okay.
the Zipbound or Monjaro, it contains tirzepatide. The sapatide and
Thank
yes, that's also, they all have the similar side effect like Ozempic, but the issue is the sapatide is a double effect compared to Ozempic. Ozempic is a GLP, agonist. Why tirzepatide is both GLP and GIP. So
you.
as a result, it has it's a dual effect, and it's more the GIT effect, the gastro effect is even more with Monjaro or Zibam
Okay.
compared to Ozempic. Yes, thank you so much.
Okay, so I have more questions. I think I will take maybe two or three more and then we can
Okay,
round off the day. Okay,
okay,
so someone has asked that would you advise tummy talk or lipo for android obesity?
okay. So now,
Yes.
tummy tuck or liposuction for android obesity. The first thing is before you do tummy tuck or
Lipo.
lipo, you need to know what that obesity has cost you, because there are a lot of people that present to the hospital in our ICU care, and in different other places with issue of tummy talk, and their wound is not healing, is septic. Because if the obesity has caused diabetes, you need to control all the complications those obesity have caused before you now plant your tummy talk. So the issue is tummy talk is good in terms of reducing android obesity, but it's just that people present themselves without managing the complication the obesity has caused. So with the diabetes, their blood sugar is not controlled, wound healing is poor. They went to do tummy talk. The wound that was created during tummy talk and liposuction refused to heal, and it became septic, and it becomes a barrage of health-related challenges. So all these things should be under a doctor's supervision. When you present, the doctor assess you and look at you and now advise you on what you can do. So I think that is the best way I can answer. So it's useful for 100 obesity. It's useful.
Okay, so two more questions. One from the two is, does carbimazole slow down metabolism? So that means, does it make you gain weight? So does it
Yes.
slow down your metabolism, thereby make you want to gain weight, even though one is not eating much?
So now, like I said, there are endocrine causes that can cause weight gain. There are endocrine causes that can cause weight loss. A patient on carbimazole is being treated for an endocrine cause problem called hyperthyroidism. Hyperthyroidism is when the thyroid hormone is in excess and the person will be dropping weight because the thyroid hormone helps to regulate the metabolism. When there's hyperthyroidism, the thyroid hormone is excess. So the metabolism of that patient is ×3 or ×4 of what is supposed to be. So the person is dropping weight drastically. So, and the
Okay.
treatment of hyperthyroidism to normalize the thyroid hormone back to normal is carbimazole. So when carbimazole is initiated, the carbimazoles try to bring down the high thyroid hormone back to normal. And in bringing down the high thyroid hormone back to normal, the high metabolism rate that the hyperthyroidism has caused, the high thyroid hormone has caused, will start to decline. As the high metabolic rate is declining, it's natural that the weight the person lost because of the high metabolic rate will be regained back.
That's
So
very
that's why it
true.
appears that carbimazole is causing weight gain. It's not like the drug is causing weight gain. It's because it's suppressing the high metabolic rate from hyperthyroidism to down to normal metabolic rate. As a result, the high metabolic rate that was causing the person to drop drastic weight is suppressed and the person starts regaining those weights. So carbimazole is not really a drug for weight gain. It's just a drug to regularize your thyroid hormone back to normal. So that's why we see a lot of hyperthyroidism patients when they come in. Most times they are thinking, is it HIV that they have? And they come with different HIV tests. By the time we screen them and tell them, no, what you don't have HIV, madam. What you have is hyperthyroidism. So by the time we start treatment, they start gaining weight and they now think it's the drug that is, but it's actually the drug suppressing the excessive metabolic rate the disease caused to normal that makes them regain some bit of weight. Yes.
Okay, thank you so much. I hope that answers the person's question. So there's a question that says, there are some drugs that one must take with food. So you mentioned that people shouldn't eat at a certain time at night, and I think this person is trying to address that, because this person is saying that there are some drugs that one must take with food, most especially also patient. How can they manage this at night?
So the issue is there's an ideal time for eating. So when a patient has an ulcer, don't use your eating to solve the ulcer. Rather, go to the hospital and treat the ulcer so that you can be well. So now, there are some, when you have an evening drug to take, you can take it in the evening by 6 p.m. with your dinner. What I'm advocating for is take your dinner early.
Mm.
So it's not as if don't eat, but eat at the appropriate time.
Mm.
Take your dinner early, don't take it late. Taking it late is not the ideal way of taking your dinner. Your dinner should be taken early. So it should be taken between 5 and 6 p.m. Sometimes we give some allowances to 7, but not taking dinner by 11 p.m. And if there's an ulcer, go and see the gastroenterologist. They will do endoscopy for you. They will treat the ulcer, give you drugs that can heal up those ulcer. And if the ulcer is caused by H. pylori, it will be treated and you'll be fine. So, but it's important we need to eat at the appropriate timing and not just eat just any time. That's what I'm advocating for. Thank
Thank you
you
so
so
much, ma'am.
much.
One last question. One last question. Is the injection for losing weight now available in Nigeria? Someone just asked that.
Okay, thank you so much. So the injection is available, but the company that owns the injection, like Ozempic, is owned by Novo Nordisk. They've not officially launched the drug in Nigeria. They are still planning to launch the drug in Nigeria. So majority of the Ozempic that is gotten through some collaboration with some companies, the hospitals that have them, they get it through collaboration from companies abroad. But for the real drug, the Ozempic, the owner of the drug, they are still planning to launch the drug in Nigeria. So officially, until they launch that drug, before a lot of things can be put in place. So when you want to get your Ozempic, make sure you get it from a very, very reliable source. Although it's in Nigeria, but it's not from the company that owns the drug. It's through some other collaboration with other people. So, and unfortunately, a lot of fake ones or parallel importation are coming into the country. So you need to be extremely careful so that you don't end up with the other version and develop even more complication than what you are trying to solve. Yes.
Okay, thank you so
Even
much, ma'am.
Monjero.
Even though
Monjero
I
too
keep
is
saying, okay, even though I keep saying two more questions, someone has put another question, and I want just this should be the last question, please. Please, nobody should put in any question because I don't want us to leave without answering all our questions. So someone just wrote, what can you eat after 7 p.m.? Should you sleep late?
okay. So now after 7 p.m., I tell people you can feel hungry or you can feel, so you can do something. So after 7 p.m., after taking your dinner, maybe you took your dinner 5 p.m. or 6 p.m. and you feel a little hungry, you can take salad.
Okay.
You can take salad, you can take pepper soup with small fish. Not that you take pepper soup with a very long catfish. You can take it with just a small, you know,
Yes.
yes, just to, you can, take vegetable sauce. You can take some efori roll, where you prepare some efori roll or garden egg sauce with some small fish and just take it and drink water. Do you understand? So you can take those things. And now sitting to eat fufu by 10 p.m. is endurance. Yes.
All right, ma. Thank you so much, ma, for this very insightful session. Really appreciate you so much. So, on this note,
Thank
I'm
you.
going to have to say bye bye to us of to this session. So, bye. So,
Sorry, ma, please, ma. We've not done the post test.
oh, that's
Post
true.
test.
Because of our time, I was thinking maybe because I'm looking at the platform already and
Is
I'm seeing that people are leaving. So, okay, all right, man.
okay.
Let me call Mrs. Olorunrinu. Please, are you there? So she can share the post test with us.
Okay, yes,
Mrs.
I'm here. Just a
Okay,
moment.
thank you. Please kindly share the post test so we can take that quickly. I think we have like 3 minutes to take
All right.
the
Let me know if you
post
can
test.
see it.
Okay, it's on. I can see it. Can we all see it?
Um, I don't see anyone participating though. It still says 0%.
Okay, so can we all participate in this, please? We have like 2 minutes.
Okay, just one person now.
So how many percent so far?
2%, 4%, 7%.
Okay. How many now? So
13%.
somebody has just said they can't see the quiz.
Okay.
Can we all see the quiz, please? Can we just signify by saying yes in the chat room? How many percent now, Mr. Loreno?
I think 32%.
So 17 out of 53 people.
17 out of 50 people.
Yes. From the look of things, I think you said 2 minutes. So it's 2 minutes right now.
Okay, so should we give it 1, 2 minutes so people can, or should we just leave it? How many people have submitted now?
21 out of 52.
So let's give it like another 2 minutes. Is that okay? And then you can just
Okay, end it. Yeah, that's fine.
okay.
So while people are, filling the quiz, I do have a question. This comes from someone on YouTube. Can I go ahead?
So Ms. Okuno, Dr. Okuno, this question is for you. So she said
Yes, ma.
this question is for someone from someone who joined on YouTube. So Ms. Olorunrinu, go ahead,
Okay.
please.
Okay, ma. So the question says that the person is currently or was told to take Contrave, and she's scared about taking it. It was from her doctor, but that she's scared about taking it because of some side effects, because she saw something about it being suicidal. Should she go ahead with it or not?
So I didn't get the earlier part of the question, ma. Sorry.
Okay, ma. So there's a person on YouTube saying that a doctor asked her to take Contrave. I think you mentioned the drug
Okay.
during your
Contrave.
presentation.
Yes.
But the person is a bit pessimist about it, because she mentioned that while she went online to check, she noticed that it had side effects that talked about suicidal thoughts. So should she still go ahead or not?
So the side effects, what's the side effects?
Thank you,
Mr.
ma. It's
Olorunrinu?
clear now.
Okay. That's fine.
So the issue
Suicidal
is
thoughts.
there are different drugs for obesity, like I earlier showed. So now, depending on what your doctor, as long as your is a certified doctor, depending on what your doctor is considering, and depending on your doctor's evaluation of you, the doctor can now determine, the choice of drugs for you to use. So, because it's not everybody that can use Monjero, it's not everybody that can use Zbound. So it's not everybody that can use Ozempic. There are some people that, because it depends, and also it depends on the severity of the obesity. Because like I said, we have class 1, class 2, class 3, depend on the morbidities that you have. So there's no drug in itself that doesn't have side effects. Even this Ozempic, Zbound, Monjero we've been talking about, they have a lot of side effects if they are not under a doctor's supervision. In as well as they have their good side, they also have their bad side, especially when it's not under a doctor's surveillance and prescription. So I just feel that what you should do is get back to your doctor, have a discussion with him or her. Let the doctor know what your concerns are. Then the doctor will be able to throw more light why he or she chose that particular drug as the drug for your weight loss. So with that, you'll be able to be on the same page with your doctor and be able to work together towards achieving a good health goal. I think that's the way, that will be my comments on that. Thank you, ma'am.
All right. So Ms. Olorunrinu, how many? So I think we should be done with the.
Yes, we're good now. We're good. 61%.
Okay. Okay. All right. Thank you so much, Dr. Okunowo. And
Yes.
I think we can call it. Okay. So Ms. Olorunrinu is sharing the results of the quiz. Okay. Okay.
Also, they said for another 1 minute. However,
Okay. Okay. Do you want to share the results?
yeah, people are viewing it already.
Okay.
Okay.
Oh yes. Okay. So just for 1 minute. Okay. We can call it a day.
And thanks so much for the invite. I really appreciate it.
Thank you
I
so
really
much.
appreciate the invite. Thank you so much.
All
Thank you
right.
so
Thank
much,
you.
man.
Thank you, Dr. Okunowo. Thank you so much.
Yes, ma.
Much.
Yes, ma.
I'm done sharing.
Okay, all right then. So thank you so much. Let's call it a day. Have a good night.
Okay. Yeah,
Thank you,
bye.
everyone. All
Thank
right,
you.
Yeah,
bye. Take care.
Bye.
bye.
Bye-bye. Bye.
Bye-bye.
Bye. Bye. Bye.
Bye.
Thank you so much. Nice.
Bye-bye.
Well done, ma.